Joining us now to talk about the surge in COVID-19 cases overwhelming our healthcare system is State Senator Chris Kapenga. Senator, thanks for coming back on the program.
Yeah, glad to be here again. Thanks.
Senator, the last time you were on this show in August, you called the governor's mask order a scare tactic, noting since our hospitalizations back then were low, his order wasn't necessary. But clearly that is not the case anymore. Some hospitals are overflowing with patients. Do you still stand by those comments that these orders issued by the governor are a scare tactic?
According to what the governor is saying, logic would tell us if we are wearing masks, we should see a reduction in cases if we went into, from a no mask to a mask, or if we went from a mask mandate to no masks. The governor's logic would mean that we should see a significant decrease in cases. So what I keep saying is the mask mandate is just, I call it a placebo effect to make us feel good about ourselves. Let's focus on, again, ICU beds and how many people are in the hospitals. And if those are rising, which they are increasing now, let's look at things that we could do to make sure we're managing that. But the mask mandate, again, is just, it's sidetracking everybody. And essentially, I think everybody can agree, it's become really a political issue. If you wear a mask, you're a Democrat. If you don't wear a mask, you're a Republican. I don't think that's healthy for society either. We have to stick with the facts of, does it work or not?
So you don't believe hearing scientists, top scientists on the national level, here on the local level, state level, that they say they do make a difference. It helps prevent the spread. So you don't believe masks are making a difference?
I go back to the reality of what happened when the mask mandate dropped off and what happened when the mask mandate went back in. And for every study that somebody brings up on masks work, there's other studies that say, well, that's not proven. So we can have this very detailed argument about science, or we can say, let's step back. And that's my job as a policymaker, is to step back and look at what is reality.
So if you believe these orders, specifically the mask order by the governor, is illegal, then why not come back into session and strike them down right now, before the election?
So if we step in and go through the normal course of action under a legal emergency order, we then can just simply pass a resolution that would take the order off the table. The problem we have is if we take our legal course of action under a legal order, I don't want to have it where we start setting a precedent and essentially by our action making it look like the governor's order is legal. That's the problem we have.
I kind of want to know a yes or no answer here. Would you support striking down the mask order if you came back to session to do it?
Absolutely. I would 100% strike down the mask order and then sit down and have a discussion with the governor, which he's supposed to be doing with us, having a discussion about, okay, here's the reality of the situation. Here are the facts behind where the cases are, why they're coming up. And then if there's a need for the government to step in and take a course of action, let's do that. But if there's not, let's not step in. We have to let people live their lives. People in Wisconsin are intelligent people. The government is not smarter than the people. So let's let people make their own decisions on this as well, unless it gets so bad that our hospitals are overrun. We're not to that point yet. We are seeing some concerns. So I'm okay with having that discussion.
Are you okay then with schools not having masks? Because they're covered under this mandate.
Yeah, absolutely. Again, we have to look at the facts of are masks helping or not. And we see that they are not. And there's also all this, now that you bring up schools, I have a big concern with some of the data that's coming out on the respiratory issues that these could be causing with kids.
But do you worry at all what type of message this sends to some Wisconsinites? You are supportive of getting rid of a statewide mask mandate and other health orders, while our state is ranking the worst in the country, one of the worst in the country for COVID cases.
Yeah. Again, the problem here is the legislature is not at the table to have those discussions. The legislature is not able to get the facts and information to help make good decisions.
I heard early on in this pandemic from GOP leadership that they have a plan. So do you know what that plan is? Do you have a plan to address this pandemic?
Well, we actually had a plan put in place. I helped design the WMC plan. If you go look at that, where we said, hey, let's look on a regional basis. Let's look at where the risks are. And if it's not necessary, if it's pockets of it, let's focus and have the discussion about those pockets, but not do a statewide policy that I just don't believe it's good public policy or good for the people of Wisconsin.
Are you okay that the governor took this action to open a field hospital on the state fairgrounds because our hospitals are so overwhelmed?
It's hard for me to give you an answer on that, because the problem is it's almost like Aaron Rodgers makes a play call and then puts a blindfold on the rest of his team. I can't make good decisions if I don't have good information in front of me. Any leader knows that. And the governor is not sharing the table. He is doing this unilaterally, and he's not giving information
But
out.
Hospitals are overflowing in certain areas. So we got to put those people somewhere, right?
Right. So I don't know. Okay, the ICU beds are coming up close to the capacity. So yes, we have to take a look at that. But I don't know, is 80% of the ICU beds non-COVID related? I don't know that. Are there people in the ICU beds who don't necessarily need to be there? And I can't make a good public policy decision when I'm privy to 10% of the information. The governor needs to share this information with the legislature. That's responsible governing. It's constitutional. It's following the law. Give us that line of sight. Let's sit at the table and have those adult discussions together. But right now, we can't even do that.